In every woman, it's 33% have some version of pelvic floor dysfunction in their lifetime. In women who have had children, it's 50 to 85%. And then you have a decent percentage of men over the age of 50, about 25 to 50%, that are dealing with some version of pelvic floor dysfunction. There's an answer to this problem that nobody's really talking about. Just realizing how prevalent it is and how few people are getting real solutions to it. Today, we're talking about something that's a little bit different. We're talking about pelvic floor dysfunction. And this has been something that I've been doing a deep dive on as of late. And to be completely honest, from my end, I did not realize how significant this problem was. So I think pelvic floor dysfunction is one of those conversations people don't like to have, partly because it's uncomfortable. And in the women's world, it's just expected that it's normal to have problems here. And when we study this, that's not the case. There's a lot that can be done. But it's so prevalent that you can tell we're not doing anything for treatment right now. So when we look at pelvic floor incidence, in every woman, it's 33% have some version of pelvic floor dysfunction in their lifetime. In women who have had children, it's 50 to 85%. And then you have a decent percentage of men over the age of 50, about 25 to 50%, that are dealing with some version of pelvic floor dysfunction. So you're like, this is a massive number of the population. And that leads to things like urinary incontinence, leaking if you're women, a lot of low back pain, a lot of hip instability and pain. For men after prostate surgery, it can definitely be a problem that helps lead into erectile dysfunction. So when you start looking at it, this isn't like, oh, it's for these people off to the side. This is a population level problem that we need to address. And what got me really excited about this is we started looking at treatment options to be able to address the nerves, the tissue health, the muscle health in that area. And when you break it down into its subcomponents, you're like, this is solvable. This is something we can fix. We can use advanced treatments to make sure all the nerves going to and from the pelvis are working and firing well. We can use advanced technology to strengthen the pelvic floor muscles and give strategies to continue to improve coordination and control over those muscles. We can use regenerative therapy to heal and break down scar tissue and recover after a pregnancy or after an injury, even with long-standing problems here. So these symptoms it's not just like this normal part of aging that everybody kind of, expects to have. There are real solutions to this. And whether it's coming from like leaking, or it's causing low back pain or hip pain or SI joint pain, we see so many women who come in saying they have SI joint problems, and we actually find out that they have a pelvic floor problem. Or it's causing sexual dysfunction. A lot of women report pain with sex. A lot of women report dryness or burning or irritation, and that is a symptom of pelvic floor dysfunction. So it's not something that works in isolation. It affects so many things around it that I think this is a much more important conversation for us to be having than is like portrayed in doctors' offices or online or in media. So when we start to address this, the good news is I think even just the traditional pelvic floor therapy can be quite effective. There's been a lot of studies that show teaching people like Kegel exercises where you're just trying to strengthen those muscles is decently effective for women after pregnancy. It's decently effective for men who are dealing with erectile dysfunction. But there's a lot of exciting breakthroughs in this. So there's a very big emerging field in terms of pelvic floor medical dry needling, where we're using these little tiny monofilament needles to go all the way into the pelvis to address scar tissue, nerve dysfunction, and muscle or tissue injuries. So that needle goes in and tells your body like, hey, there's a problem here. You need to come heal it. That's a big area of research and training that a lot of people are doing. In our office, Dr. Chloe Hammett is our pelvic floor specialist, so she does all of that stuff. You can do perineural stimulation, where you take those needles and go close to the nerves that supply all the pelvic floor muscles and basically turn them on using electrostimulation. There's another big field when you look at magnetic muscle training, and this is really exciting and also feels very strange, where you use basically a giant chair that has a magnet built into it. And what that does is it depolarizes all the muscles in your pelvic floor so you can strengthen them. And as you sit on this chair, you feel your pelvic floor muscles turn on and turn off, turn on and turn off. And the research around this shows in like 2 months, you can improve the muscle strength by 30 to 40% doing that a couple times a week. And that is massive if people have dealt with long-standing pelvic floor problems, because those muscles get so atrophied and so weak that even if you're taught how to do these exercises, you probably don't have the control to strain those muscles enough to get them strong. So we usually need a leg up to actually start building that muscle so we can regain control, so we can continue that process going. I get really excited, especially whenever Dr. Chloe and I talk, because if you start putting these pieces together and you add in some regenerative therapy that helps your body heal or build muscle, there's an answer to this problem that nobody's really talking about. And like that does involve these different things where you're doing manual therapy, some version of needling, education, some version of magnetic stimulation, some breathing training, and then some strengthening. But if we do those things, this is not something that we need to continue to brush under the rug. This is not something that we shouldn't be talking about. And I think what got me to the point where I wanted to record this for y'all is just realizing how prevalent it is and how few people are getting real solutions to it. So there are answers to it. There's a lot of breakthroughs that are out there that are coming, and we're going to continue to push the envelope with this, with using things like laser to penetrate deep into the pelvic floor muscles and stimulate cell regrowth and regeneration. We're going to continue to increase our muscle stimulation to the pelvic floor, and continue exploring other options, because this is a very big part of our life and our health. And I don't want people to not know that there's a solution. So if you've dealt with it, or you know somebody who's dealt with pelvic floor stuff, send them this, but also tell them, like, find someone who's willing to think outside of the box and actually give some treatment, and really, quote unquote, dig in to give some relief. But there's definitely answers to this. So I hope that helps. I hope that gives somebody a little bit of hope out there who might be dealing with something and just kind of accepted it as normal. If y'all have questions, hit me up. I would love to do this and answer any questions. But stay tuned. We're going to have a full kind of dedicated masterclass on pelvic floor health, pelvic floor function, coming soon. So if you have questions on that, shoot those over, and we'll definitely cover them whenever Dr. Chloe and I do a full deep dive on pelvic floor function. But have a great day, everybody. Do that one thing to get a little bit healthier today.